Hello, my name's Nancy Hill, and today we're going to talk about what is a nurse practitioner. I am currently a student at Auburn University in the primary care nurse practitioner program. Our objectives will look at the education and certification of a nurse practitioner. We'll look at the role of a nurse practitioner. We'll look at the work settings and the nursing model of care. Now, as far as the education of a nurse practitioner, you start out as a registered nurse. Either that can be an associate's degree or a bachelor's degree nurse. I started out with my associate's degree in nursing. I then took the NCLEX, which is the certification exam for registered nurses. From that point, I moved on and obtained my bachelor's degree. And then after my bachelor's degree, I applied to the master's program at Auburn University for their primary care nurse practitioner. At this time, I am in my second year of the nurse practitioner program at Auburn University. The master's or doctorate programs must be accredited. They cover advanced pathophysiology, advanced pharmacology, and advanced physical assessment. Advanced pathophysiology is more about what's going on inside the body. You must be familiar with the anatomy. Advanced pharmacology gets us familiar with medications and how medications act on the body and getting us ready for writing prescriptions. Advanced physical assessment is the ability to do an advanced assessment on a patient to see if everything's normal or if there's some abnormal findings that lead to diagnoses of acute or chronic conditions. Next, after you obtain the master's or doctorate degree, at that point you take the certification exam for nurse practitioners. And once you obtain a passing score on that, you become a certified registered nurse practitioner. You can also have specialty certifications as a nurse practitioner. These include primary care, geriatrics, pediatrics, cardiology, women's health, dermatology, mental health, and emergency care. Now, the role of a nurse practitioner. The role includes advanced assessment of patients, ordering diagnostic tests, and then being able to interpret the results of those tests, diagnosing and managing acute and chronic conditions, educating patients, and prescribing medications. There are a variety of work settings that nurse practitioners work in. They can work in independent practices, they can work in physician offices, health departments, urgent care offices, mental health facilities, long-term health facilities. And then primary care nurse practitioners provide care to all age groups, including infants, children, adolescents, adults, and geriatrics. Now, nurse practitioners work on the nursing model of care. And what is the nursing model of care? Well, it deals with health promotion, disease prevention, patient education, and the utilization of evidence-based practice guidelines in the treatment of acute and chronic conditions. For example, I am very passionate about strokes and preventing strokes. So health promotion may be educating my patients to eat a healthy diet, to keep their cholesterol under control, to keep their blood sugars in line. That also goes along with disease prevention. Following these things also helps to prevent the stroke from happening. So I would look at all the risk factors for a stroke, such as high cholesterol, high blood pressure, diabetes, and multiple other things such as atrial fibrillation. There's many different things that you look at as far as disease prevention. And then patient education is just taking the time to sit down with our patients and thoroughly educating our patients on a level that they can understand about health promotion and disease prevention. And then last thing is utilization of evidence-based practice guidelines. Instead of just guessing, if a patient comes in with high blood pressure, I could just start guessing and trying different medications. But instead of doing that, we look at evidence behind other patients that have had high blood pressure, what's worked for those patients, what medication works most often for those patients. And the research guides us in what to prescribe and what to look at. Now, nurse practitioners, at this time, there is a primary care provider shortage, especially in rural areas such as the area that I live in. So nurse practitioners can really help to solve this void in care. Their experience and their education makes them appropriate providers of primary care. And then your nurse practitioners, they focus on the holistic care of patients. They look at the health and wellness of the patient. They do that thorough patient education like we discussed, and then they also manage acute and chronic conditions. Here are the references that I used to complete this video. Thank you very much.